I got started in medicine when I was a senior in high school, when I started working on an ambulance and became an EMT. Being an EMT sparked my interest in healthcare, and from that point I started working at what was then Clay County Hospital. All I could think about at that time in my life was becoming a doctor. Started my practice back here after I finished medical school and did an internal medicine residency until 2004, when I went out of private practice and started the first hospitalist program in Terre Haute, Indiana.
I joined him about 3 weeks later with two other doctors. It was a nervous time. It was an unknown about the buy-in of the doctors in the community admitting their patients to us and walking away from a hospital practice. It was unheard of, but it didn't take long, and we were well received by the community.
John was one of the first hospitalists here, and early in 2006, maybe 7, somewhere back in there, I turned my inpatient practice over to the hospitalist. And so at that point in time, I interact with him a lot. Oh, as a physician, I'd say he's one of the best I've ever come across. His qualities are that he puts patient care first. He is not, he doesn't always necessarily do the most popular thing, but he always does the right thing.
He's idealistic, he's hardworking, he's honest. The hospital stole him from us and took him into administration.
I've always felt that everyone in medical care is equally important, no matter what their job. And I think I'm seeing it now from the administrative standpoint, because if the administrators aren't doing their job, we're not going to have a hospital in our community. So it opened my eyes to the non-clinical part of medicine. One of the things I love about my position is I still get to be active in patient care. Right now, most of my patient care activity is doing teaching rounds with the family medicine residents at Union Hospital.
When I was a resident here, Dr. Weinbaum was very innovative. He was doing things here at this hospital that were not even being done anywhere else in the country. He was educating us as residents, and even in my early career. Well, John does the same thing. On his own time, he works with our residency. He 4 to 6 weeks a year over in the hospital. He does this to maintain his clinical skills, but he also does it because he enjoys teaching. And the feedback I get from the residents who have the opportunity to interact with him is incredibly positive feedback. He's a great teacher.
Dr. Weinbaum would have approved, undoubtedly. And John is hardworking, he's professional, fantastic for the hospitalist program. And that, plus his administrative job since he did the hospitalist program, both these things in the last 13 years or so, he's just been a star, and he's been a great asset to Union Hospital.
I look forward to continue growing in medicine, continue learning, continue teaching. I still enjoy and truly love taking care of patients in the hospital. I like to interact with people. I like to get to know them as a person. I've been so blessed to do what I do, to love what I do, and kind of living out the old saying, if you find a job you love, you'll never work a day in your life. I think that fits me pretty well.
John, congratulations. You certainly deserve the Weinbaum Award. You've done fantastic since the day you arrived in Terre Haute.
John, congratulations on this award. You very much deserve for this award, and I'm very happy for you.
You did a fantastic job in the hospitalist program, and you've done well in your administrative position. I worked with you closely. You're a doctor's doctor. You're honest, and I'm very proud of you. You deserve it.